I read somewhere that diabetes is showing up in children as young as 8, and I was wondering what that's going to do. Would this really decrease their lifespan for the first time in generations?
Yeah, that's a really good point to bring up. So I think that the scary part of all of this is really when it comes to the kids. And kids are becoming more obese at a young age, and you can see that if you just sort of look around. You know, there weren't many obese children, 20, 30 years ago. Now this is not uncommon, and it's increasing. And morbid obesity in children is increasing dramatically. We have one of the top childhood obesity centers here, really trying to study how do kids decide what they eat, how do they get full, what cues do they get. I mean, it's a complex thing, and it also forms within the family because you can teach the kid whatever you want in terms of what they should eat or not eat, but if the parents are eating this way, well, the kids are going to eat whatever the parents sort of eat. But you're absolutely right. So that it used to be that we thought of children only developing type 1 diabetes, that autoimmune disease. Now it's really type 2 more and more. And it was only a generation ago that a child with type 2 diabetes would have been a case report and something really that you publish in the medical literature. Look at this. Wow, it's unusual. Now it's happening at a younger age, and absolutely right that this is the first generation. This is really sad. That if you look at sort of humankind through history, we've generally increased life expectancy. Each generation was predicted to live longer if there wasn't a war or something famine to intervene. This is the first generation that if the predictions hold true, that the next generation won't live as long because they're developing diabetes and obesity at a young age. And you can already detect changes in their arteries at a young age. At teenage years, you can already see that it's affecting their arteries in terms of atherosclerosis risk and heart disease. So you can only imagine that what used to be heart attacks in the 50s and 60s are going to be happening in the 30s and 40s. And so the lifetime burden of having diabetes starting at such a young age is going to make the complications that come from diabetes that much more likely.
We have a question over here. I wondered if you have any opinion about what growth hormones in our food, what role that might play in this?
Yeah, I don't know. It's certainly been one of those things that's been raised as a concern out there, and as it's being used. Growth hormones are being used a lot more. Not clear. Not clear.